My name is Amani Al Bakri. I'm a pediatric ophthalmologist at King Khalid Eye Specialist Hospital. It's my great pleasure today to be hosting a unique webinar. As you know, KKESH is a leading center of ophthalmology, and KKESH as a training center has graduated more than 350 ophthalmologists, and we have currently around 85 trainees. Because we believe that mentorship is a cornerstone of any training program, we are delighted today to present a unique webinar, which is Mentorship, the Perfect Relationship Does Exist. I would like to thank all speakers for accepting our invitation, and special thanks to Dr. Nuran for helping me making this happen. Dr. Nuran Badib is a teaching assistant at Jeddah University, and currently she's a medical education fellow at University of Toronto. Dr. Nuran, you can start presenting the first three speakers, and I will be presenting the last three.
Okay, thank you, Dr. Amani, for organizing this webinar with me. It was really fun working with you. I would like to thank King Khalid Eye Specialist Hospital for always hosting educational events for their staff and trainees. And thank you to our speakers for sharing their time, especially on the weekend. We really appreciate your time and expertise. I'm pleased to introduce three of my mentors during the Medical Education Fellowship. Dr. Helen Batty, she's a full professor and has been a faculty member at the University of Toronto for more than 45 years. She's an academic family physician with national and local awards in medical education. She was the founding director of many faculty development and master's degrees programs at the University of Toronto. Dr. Helen says to her surprise about the power of mentorship. As a mentor, junior colleagues used to chat with her if they were looking to find new major career pathways. Then those mentees went to become National Ministry of Health or medical school deans or happy clinical teachers, and gave credit later to that one conversation they had with her. Dr. Abbas Gavin Rasool, he's a family physician and assistant professor at St. Michael's Hospital in Toronto. He has held multiple educational leadership roles. He's currently the program director for the Academic Fellowship and Graduate Studies program in the Department of Family and Community Medicine at the University of Toronto. He has also international academic collaborative work as he co-led for the Toronto Addis Ababa Academic Collaboration in Family Medicine. Dr. Gavin Rasool says, I really appreciate the interpersonal connection in mentoring and watching the growth of the other person. Dr. Judith Bernson, she's a family physician and assistant professor in the Department of Family and Community Medicine at St. Michael's Hospital and the University of Toronto. She's currently dividing her time between clinical practice and education. She's an associate member in the School of Graduate Studies, Dalanana School of Public Health, and lead instructor in the Teaching and Health Professions course. She has presented at local, national, and international academic venues on a range of topics related to collaborative practice and teaching and learning in the interprofessional setting. Dr. Perenson says, I like being a mentor because it gives me a lot of satisfaction to see and help mentees lean into their strengths and they progress along impressive and interesting pathway in their careers. I now hand it to Dr. Al Bakri to present the other three speakers we have tonight. Dr.
Yes,
Amani,
I was muted. So thank you, Dr. Nuran. Our fourth speaker is Dr. Zainab Khan. She's an assistant professor of ophthalmology at McGill University, and she's entering her third year of academic practice. She completed her residency training in ophthalmology at Queen's University. She subsequently completed a fellowship in uveitis and at University de Montreal. She has interest in scholar work, such as systemic reviews, meta-analysis, patient safety, quality assurance, and medical education. She has published in numerous peer-reviewed journals and presented at several national and international scientific meetings. Dr. Zainab says about mentoring, I enjoy mentoring because it's rewarding to see trainees benefit from my experiences and knowledge. Ultimately, this allows our profession to grow and deliver better patient care. Our first speaker is Dr. Ike Ahmed. He's an assistant professor at the University of Toronto. He did his ophthalmology residency at University of Toronto and his fellowship in glaucoma and anterior segment surgery at John Moran Eye Center, University of Ottawa Health Science Center. He's a director of glaucoma and advanced anterior segment surgery fellowship and research fellowship since 2015. He's a member of the ophthalmology residency program committee in Toronto, and he's a member of ophthalmology fellowship committee in Toronto. He says about mentorship, I think being a mentor helps me learn new perspectives, understanding generational thinking, foster lifelong relationship, and help shape tomorrow's leaders. Our last speaker is Dr. Rima Al-Affari. She's a general practitioner and a senior lecturer in medical education department and the head of academic mentoring unit at Faculty of Medicine, King Abdulaziz University. She has a master's degree in medical education from Mount St. Vincent University, Halifax, academic fellowship in family and community medicine, Toronto University. She's an academic leadership program certified from the Center of Faculty Development in Toronto, and she's a member in the consultancy committee for trainer program at Saudi Council. She says about mentoring, I believe that the keys for successful mentoring is commitment, flexibility, and patience. I would like to thank all of our speakers, and we will be starting our first session. You can share your slides, Dr. I think it's Dr. Judith, right?
So thank you so much for the invitation to join you with King Khalid Specialist Eye Hospital, and also for your nice introductions, Dr. Al Bakri. I do want to say salam alaikum to everyone and quickly start. You've already seen some of the people from the University of Toronto, and we can move on to the next slide. We'd like to define mentorship. And we're using this definition. Might not be perfect, but it is from Toronto and Ontario. So that's what we'd like to suggest. And basically the idea is that this is a person who is your guide. And they may be ahead of you on a career path. They may be a little older than you, maybe half a generation older. And they have the empathy and the interest to sit with you and look at what you may need or what you're considering for your own future. A mentorship meeting can be once in a lifetime, or it could be a series of meetings, usually by agreement. It can be a very formal, arranged relationship, or it can just be a one-time informal conversation. The most important thing is it requires mutual respect. And I like to make the point that we all know these other roles: friend, preceptor, supervisor, role model, coach. They each mean something different from mentor. To me, the essential element of mentoring relationships is a little bit like a friendship. Really, in an ideal situation, your mentor is someone that you have chosen for yourself, whereas some of those others you can imagine could be assigned to you by a program and would be still a very valuable relationship. Thank you.
So thank you again for having us. I'm going to review a little bit of the literature on mentorship. And the first one is the big question for people: what does a good mentor do? How do we know we're working with a good mentor? So this is some literature from the Journal of Internal Medicine. It's an American journal. They talk about a number of roles that good mentors can take. So number one is that they can provide moral support. And we often think about mentors as someone we may come to when we are facing challenges and need a little boost of encouragement. Mentors also help us with fostering self-reflection. So we all know that we are not as good as self-assessment as we think we are. And mentors can help encourage us to understand other people's feedback or perspective on us, or give us an opportunity to think about different events in our lives or ideas from different perspectives, and encourage reflection in our choices. Mentors can help us clarify our goals, particularly if they're helping us to navigate certain career paths and identify things that we enjoy, and all the different choices that may go along in designing a career. We think about that as career mentoring, but they may also help you identify goals and navigate through different challenges in balancing personal and professional lives, or getting through other aspects of our day-to-day work. And mentors we often think about as someone who may protect us or advocate for us in the organization. Mentors can be very important for helping us network, and there are someone who can speak to our abilities and help us find opportunities for advancing forward. At the end of the day, a good mentor is going to provide both support and challenge. So this is a chart that comes, or at least, was described in the literature. There's an article on building effective mentorship, 12 tips in medical teacher for building effective mentors. And they talk about how mentors should provide both challenge and support. And when you get to this top corner of high challenge, when there is high support coupled with high challenge, we see growth. And if there is low challenge and low support, then it's sort of stasis. We don't tend to progress forward. If we are in a situation where we aren't really being challenged, we have a lot of support. We think of that as validation, which can be very important. We all need validation and support, even when we aren't trying to tackle very difficult challenges. But it doesn't create the same growth as whether the mentor is also challenging us. And of course, high challenge with low support is problematic. That's what we want to try to avoid. So a mentor, first and foremost, will provide support, but if they aren't challenging you a little or helping you address challenges that you are encountering, then you may not be getting the full benefit of growth from the mentoring relationship. So this is some information, it comes from an article called Demystifying Mentoring, and it comes from the Harvard Business Review. A lot of what medical education uses in mentorship, a lot of what we know about mentorship actually comes from the business literature, and you'll find a lot of articles in the business literature about mentorship and the importance of mentorship within organizations. So this is an article about how we tend to think about having one mentor, or a mentor that is going to help us progress through our careers, but that's really not the reality for most people. Most people, so myth number one is that you have to find the perfect mentor. The reality is most people have a network, or should try to cultivate a network of people that they trust, that they can turn to for advice. And sometimes the best way to identify a mentor or mentoring relationships is think about the people whose opinion you really value, and people who you may be able to go for advice or perspectives on problems, and you can trust them. It's not necessarily true. Some people have one lifelong mentor. Many people have a mix of mentors that help to fulfill a different number of roles. Myth number two is that mentoring is always a long-term formal relationship. And I think, again, that is true for some people at some times, but there are also, I have had some very effective mentorship meetings that are mentorship moments. They are a one-time meeting with someone who has given me some very helpful advice that has impacted my career, and or someone who I've met with 3 times to help with a particular problem and received very effective mentoring. So it's helpful to think about both short-term and long-term opportunities for mentorship. The third myth is mentoring is only for junior people. We know that everyone will benefit from mentorship, even if you are very senior in the organization. And it's helpful for us to remember that mentors aren't always ahead of us in their career pathways. Sometimes they may be junior to you, but experienced. So for example, someone may be junior to me in their career, but have experience writing for a particular grant application and be able to mentor me through that process because they have more experience than I do. There's also increasing literature on peer mentorship. and the value of having mentorship between people at the same level of training, because mentors can help with reflection, with perspective taking, with understanding your strengths. And those are things that even our peers could help us with. And the fourth myth they talk about in this article is that the myth is that mentoring is something that more experienced people do just out of the goodness of their hearts, that it is always the mentor giving to the mentee. And that's actually not true. Mentors derive a great deal of benefit from mentoring relationships, and mentees often have a lot to offer. And so we aren't going to be covering today some of the different boundary issues that can come up in mentoring. The mentor shouldn't be taking advantage of the mentee, but the mentor also benefits from hearing the mentee's perspective, learning about what they're experiencing, seeing things from a different perspective that the mentor might be facing. So it's important to remember that mentoring is a two-way street, and that mentors do it because they benefit from it. And that makes it a little easier to ask for mentorship when we're looking for it. This is another article, again, comes from Forbes magazine, that talks about thinking about having a personal board of directors. So again, rather than having one mentor who mentors you through the entire trajectory of your career, it's helpful to think about having a board of directors the way an organization would have a board of directors to help guide you as you progress in your career path. So they suggest thinking about having a mentor who can fulfill the following roles or is in the following positions. So someone who is in your chosen field of work or study, someone who shares your life circumstance. So that may be, for example, family circumstance, someone caring for older parents or caring for young children, someone who will encourage you or be a cheerleader for you, as well as someone who is ready to critique you and to give you feedback that might be difficult but is important for your growth. To have someone who is a leader in the area in which you want to aspire or succeed. Someone from another generation is very helpful. Because of life circumstances, experiences, people who both who know the history of your organization and who are seeing it, for example, for the first time, so junior faculty. And someone who can introduce you to others or advocate for you to help you with networking is another important aspect of mentorship. And the reality is, no one person is going to be able to do all of this. That's not really a fair ask of them. And so it's helpful to have a team of people or a board of directors. I think maybe I'll pause here just for a minute, and I'll ask everybody who's watching to just take a minute of your time and think about some people who might fit this criteria that you know in your life. So take a few minutes and write down a piece of paper. It can be private, you don't have to share it with anyone, just some names of people who might fit 2 or 3 of these descriptors. So I'll give people another 10 seconds. I think it's helpful to have some specific examples of people to think of when we're talking about next steps, which is how do you then build a mentoring relationship? This again comes from Forbes magazine, is an article that talks about great questions to ask a mentor. So let's say you've identified someone who you would like to ask for mentorship or you feel would be helpful to get some mentorship from. How do you start that conversation? What do you say? And I've done a number of these actually in different ways. The number one thing you can do is ask for advice on a particular challenge. So you send someone an email and say, I've been asked to take over as a chair of this committee, and I know you've done this role before, and I have some questions for you about it, or I'm working with a student in my course, and I'm having some challenges and helping, could we meet to talk about this? I think your advice would be particularly helpful. Most people are pretty happy to say yes to something like that. And that's one way to start a conversation. Another way to start a conversation is to send an email, a connection to someone and ask them if they will meet, and just say, I am really interested in the work that you are doing. I've followed your work on Twitter, or I know you from, you know, this conference that I heard you speak, and I'm really just interested to hear about how you got from where I am to where you are. I met with someone not that long ago about that, and they gave me some advice about a leadership course that I thought would be helpful to take. And they said, I took this course and it was really helpful. And getting tips like that both helps to start a relationship with a potential mentor, but also gives you ideas about the kinds of experiences or learning opportunities that would be helpful in moving you towards that position. You could ask, number 3 is ask for feedback on the way you are perceived. This can be a little frightening to start off as a conversation, but if it is someone that you know or someone that you work with, asking for their perspective on a meeting that you are at together is, again, a helpful way to start a conversation. And also asking for help improving or developing a certain skill set are good ways to start the conversation. And mentorship relationships may be focused on just that particular ask, or you may find that you really have good rapport with this person, that they say, you know, I'd really be interested in hearing how that worked out. Please let me know. And you follow up with them and the relationship will go from there.
Thank you, Judith. And thank you to the organizers for having us. Again, very grateful for this opportunity, and also thankful to everybody who's joined us quite late in Saudi Arabia. So I'm going to talk a little bit about mentorship needs during COVID as a particular example of mentorship. And what we'll ask you to do in a minute is to type your answer to this question in the chat box. So if you're thinking about the learners that you teach, whether they are medical students, undergraduate students, residents in a discipline, think about how are their needs changed because of what's happening during COVID-19 times. And what are their needs now? So we'll ask you to put those comments in the chat box, and then we'll spend a few minutes talking about those. So go ahead and type some answers into the chat box. You can use 1 word or 2 word, just short sentences would be okay. And for those that have joined us a bit late, we're taking questions at the very end of the presentation. So feel free to put those questions in the Q&A box, specific questions that come up, and we'll address those at the end.
For some people, it's saying that the chat box is disabled.
Okay, well, I guess we could.
So, Nuran, no, I think it should not be. So what?
Yeah.
Can you write now? I think it's open. Disabled? Okay, we'll fix it. You can proceed, Dr. Abbas, and I will.
Sure, I'll let you know some of my thoughts. Certainly, I think in most situations, we have been quite isolated. So most of our learners, our undergraduate trainees in large parts of the world have been removed from clinical programs if they were in a clerkship type situation. As Dr. Badi's looking at, people have had a lot of anxiety. They've also lost opportunities for peer connections and connections to their to leaders and to educators, to program directors. They've lost opportunities for feedback from peers and also from educators, right? So if in terms of their development, they would have had role modeling in the clinical environment, they would have had a chance to speak to peers and learn from that. And some of those things they've been able to continue in a virtual way, but many of those opportunities, the more informal opportunities, have been lost. And that's one of the places where there is a possibility for mentorship to play a bit of a role, where we can maybe reach out to our mentees and make connections with them and make sure they're doing okay. Make sure that their plans for their career, for example, remains on track. or give them some advice about where the opportunities might be given the changing circumstances and the uncertainty they might face. For example, in the Canadian environment, there was some uncertainty about what their exams would look like at the end of residency and when they might be able to start work. Some of our residents in our program were uncertain about taking positions that were maybe in a more rural or remote region, not knowing what it would be like to start a practice in that area. So having a conversation with that learner about what it might be like and what the opportunities might be and how he might navigate that was something that this learner found particularly helpful. Maybe we can move on to the next slide, Judith. So as Nuran very smartly and astutely asked us all, what are the benefits that you get out of mentorship? And I think I was really pleased to see that we all selected different things. We all picked a different part of the mentorship relationship. There was lots of overlap, certainly, around connections to people and watching the other people grow. But we all had a slightly different perspective. And so one of the other questions, as we as faculty have been also isolated and lost the connections that we had with peers and the ability to get feedback from peers and how we've become in many ways disconnected from our teams or have had to work with different teams than usual because we may have been redeployed to different hospitals or different situations, that there are benefits to us as well. And so we, as faculty, bring some experience. We've maybe been through a crisis before. So some of us who live in Toronto have lived through SARS before and have an experience with how to recover after quite a disruptive event for the healthcare system. There are people in the system who have lived through other disasters and who are familiar with the path of recovery after those. So being that voice of stability for our residents and learners and reflecting on those previous experiences can be something that can be helpful both for us and giving us hope for the future, reminding us that this is something that will pass, but also letting our residents and learners know about that. I think, as Judith had mentioned, there's definitely other benefits to us, for us individually, to be a mentor. We can pass on what we've learned, and we can certainly, by providing some guidance to people that are coming after us, that can help clarify some of the pathways that we've used to get to where we are. And I think can also help us clarify the values that we find important ourselves. We can move on to the next slide.
Can I add one more thing to that excellent list that you are, I think it's also important for mentors sometimes to say they're having a hard time too. Absolutely. So as much as it's very helpful, I think, to get perspective, I do think, as people were mentioning in the chat, there's a lot of anxiety and stress at this time. And it's helpful to know that people who you think are very successful in their careers also are having a hard time, and that it's normal to do that and that we can persist and help each other. So I agree with everything on your excellent list. And I think sometimes mentors feel they have to have all the answers, and they don't. Sometimes they just have to be honest and good listeners.
You're absolutely correct. Actually, so it brings to mind a recent example where I had a discussion with a few more junior people, and where we all shared the difficulty we were experiencing. But the ability to have that conversation between three of us allowed me to go up to other people in our department and say, there's an issue here we need to fix. And so using my experienced voice to be able to say, I've heard this from other people and it's something that I'm experiencing as well. Both normalized it for those people, but also allowed me to be able to affect a change in our program. So this leads nicely to the idea that the organization that we work for also benefits from mentorship. And again, this is one of those articles that is not brand new. This stuff has been known for a long time. We've been a bit slow in adapting it and thinking about it in medical education in a more formal way. But there are definitely benefits to the organization of mentorship. At the top of this list are things like employee motivation. That sense of connection that we develop through mentorship can really help people continue to work on tasks that can sometimes be difficult. It improves job performance, again, because of the sharing of knowledge that happens in an organization, and that can be helpful to more junior people. It can also help more senior people see where they're at and the skills that the more juniors are bringing up. There's lots of evidence around retention rates in organizations. And that's in some disciplines a bit of an issue in the health professions, and other disciplines it's not. Certainly there's organizations and medical organizations have a sense of a culture of shared values that are important, and mentorship is a really important way for those values to be communicated from one generation to the next, from one group of people to the next, while allowing novelty and change to happen. And then this last example, I think, is something that's really quite interesting, is this idea that as we mentor, we also hear from more junior people, we hear from a diversity of voices. And for those of us that are in leadership roles, hearing from that diversity of voices and experiences can really be helpful to figure out, for example, what are some of the challenges that my students are facing in the program? Where is it that I can put some more support in the program? What are the areas that the students are having difficulty with? Which courses in the program, for example, or which rotations are especially fabulous and where teachers need to be recognized, and where are some where we may need to put a bit more resources and reconsider what we're planning. Of course, you can imagine that all of these issues, particularly the issues around maintaining organizational culture, maintaining motivation, and needing to adapt are really important when we're going through a crisis as we are now. And so maintaining contact with people across the organization through a program like mentorship can be especially important right now. If you don't mind, I'm going to move and talk a little bit about something else. So Nuran has been in our program here, and we run a medical education fellowship. We also have some graduate programs in health professions. And one of the courses that we have that Helen started several years ago is this course called Interprofessional Applied Practical Teaching. And so we would love to have any and all of you come to Toronto and take this course with us. But the lucky thing is this year, if you can't travel, you can still participate in the course, and the information is on the slide there. We'd love to have you join our course and sort of think more about medical education and improving your programs. Thank you again for having us. We're looking forward to hearing the rest of the speakers as a group and then to responding to questions at the very end. Thank you again.
Thank you so much. That was a great talk. We're going to take questions and answers at the end. So we're going to be moving to our second session, which is training in ophthalmology, mentorship in ophthalmology. Our first speaker in this part is Dr. Zainab Khan. You can share your slides, Dr. Zainab. Yes, we can see your slides.
Perfect. All good? You can see it?
Yep.
Okay. Good afternoon, everybody. Assalamu alaikum. Thank you to all of you for having me. Thank you to Drs. Nuran and Amani for organizing this and putting together such a great program. So I'm going to speak today about mentorship in ophthalmology. So why is mentorship in ophthalmology important? So I'm going to talk a little bit about some American data here that I just came across. So most ophthalmologists report a high degree of career satisfaction. So it's really, really remarkable to know that 86% of ophthalmologists are either very satisfied or extremely satisfied with their career choices. And if you look at more specifically cataract surgeons, 95% of cataract surgeons report a high degree of career satisfaction. So that's something that our specialty should be really proud about. And the other really great things about our specialty is that there's a variety of different career trajectories. So you can work in academia, in the community, You can, work in administration, research. There's tons of different subspecialties. And so there's a lot of options. But where mentorship becomes really important in ophthalmology is that it's not always clear for our trainees on how to navigate, from how to get to point A to point B, given all of the different options that are out there, especially when there's a pretty uniform residency training program that everybody goes through. And so this is where mentorship in ophthalmology can really help in addressing this critical gap and guiding our learners. Okay, so I have 5 tips on mentoring in ophthalmology. The first 3 are going to be geared towards the mentors in the crowd, and the last 2 are going to be geared towards trainees. So I'll begin with point number 1, and that's to actively engage with your mentees and trainees and to have an open dialogue. I mean, it goes without saying, like any relationship, a genuine commitment to the process is really at the cornerstone of making this successful. And it's important as mentors for us when we're approaching our trainees to tailor to their specific goal and needs rather than producing, a clinical or a surgical clone of yourself. And the other thing, and this has already been touched upon by the other speakers, but the capacity of mentoring can change over time. So in the introduction, as you know, I'm just beginning my 3rd year of practice. And so it's not that long ago that I was, in the position of a trainee myself. But from my own mentors, a lot of that conversation that I had back then on, how to find a job, how to land a fellowship has evolved now into, for example, how to lead, how to be an effective surgical teacher, how to produce departmental and institutional changes, etc. And so understanding that those relationships could be long lasting and being open to allowing them to change is important. Mentorship programs can be formal and they can be informal. So at McGill, we have a formal mentorship program in our residency program where the residents will line up a list of attending staff that they want to have assigned as their mentor for the year. And every year that mentor changes. And so that's really great for the residents because they have a different perspective each year. But obviously mentorship can be informal as well. And I think both are okay, and accepting both models is important. One of the things that mentors can do is perhaps, and this is not an easy thing to do, but maybe limiting the number of, actual mentoring commitments that they have. It goes without saying that it's often the same people that are approached by learners and by trainees, and so there can be time constraints, but to really focus your energy on properly mentoring a few people and being a solid source of mentorship is effective. And then finally, I can't stress enough how important it is to identify moments of crises with our learners. So whether that's stress, burnout, anxiety, that could all lead to other problems like self-harm, etc. And paying attention to that, particularly at points of transition. So whether it's at the start of residency, at the start of surgical rotations, exams, etc. So point number 2 is for the mentors to try to lead by example, because this allows us to build trust. Now, there's a concept that many of you are probably already familiar with called the hidden curriculum, and these are basically the unintended lessons and consequences of schooling and training that we transmit to our trainees through observation and norms. So some of the things that, off the top of my head, I could think of that would be applicable to surgical specialties like ophthalmology, or for example, how we communicate with our allied health workers. So, how you communicate with nurses in the OR. This idea sometimes that we have of more prestige with surgical procedures than medical appointments. The idea sometimes that higher volume is necessarily better care. And these are not necessarily the lessons that we want our learners to acquire, but there is an unintended lesson sometimes that is transmitted to learners that we should be aware of. The other thing is, putting yourself outside of your comfort zone, because sharing a commitment to do so allows your residents and your trainees to know that, you're learning just as they are. And so I'll use an example here of COVID. We were talking about that earlier, where I practice at McGill in the Jewish General Hospital. We're at the epicenter of the COVID pandemic in Canada. And the residents were actually required to rotate through the COVID wards. We had 7 core medical COVID wards that were in our hospital. But interestingly, for the staff, it was optional. And so a couple of us attending faculty volunteered ourselves, and it gave so much comfort and empathy to our learners to know that, you know, their faculty were willing to do the same. Similarly, volunteering in the elderly care homes, etc. And then this is a point that was already talked about, but that's, you know, recognizing and discussing your own evolution as a surgeon and as a physician, and your own failures. I think that makes mentors more real, and providing, you know, specific practical tips. For example, you know, saying things like, I have seen such and such being effective for other people. And finally, you know, again, our learners and our mentees are watching us, so to continue to provide consistent, compassionate care all the time. The third point that I have for mentors is to create opportunities. And this is where you can really be a sponsor and advance someone's career by giving them opportunities in leadership, speaking, research, promotions, etc. And a practical way of doing that is, if, you know, you see a gap somewhere in your department, nominate someone junior to fix it. Be creative, innovative, collaborative, and allow other people to implement solutions and be known for that. And that not only does that allow your department to grow, but it keeps old processes in check as well. And then finally, you know, just a few words about women in leadership and administrative roles. I have some really interesting data here. So this is specifically in Canada. So right now, about 40% of the physician workforce in Canada is women. 56% of the residents are women, 64% of medical students are women. Yet when we look at the administrative and leadership positions, a small minority is women. And so it's really important as a mentor to encourage, you know, female trainees and mentees to not be afraid and shy of those positions, because we need them at the table to advocate for men and women. Finally, the last 2 points are for the students and the trainees. Recognize where to turn to for help. Again, it was not that long ago that I was a resident and a fellow, so I know it can be scary, you know, not knowing where to go. Your program director is probably the best, one of the best people to start with. And then anyone really in your core attending staff could be a good starting point on where to get advice. The other group of people would be perhaps faculty with similar research interests. Take responsibility for steering your mentorship relationship in a direction that's useful to you. And if you're part of a formal mentoring program, demonstrate initiative. So try to reach out rather than having the mentor consistently reach out. And then be mindful of time constraints. A lot of people do mentoring on a volunteer basis. And so if, for example, you have something for them to review, like a CV, give them enough time notice so that they have the time to do that properly. And finally, familiarize yourself with different perspectives. I think it goes without saying that all mentors are going to give you the best advice that they think is possible. It doesn't necessarily mean that their advice is what works for you. And people, the thing about advice is that people give advice based upon experiences, personal values, personal experiences, etc. And so the more people you talk to and mentors you have, the better you're gonna be at being able to find the perspective that works for you. And I really like that idea that some of the earlier speakers were talking about regarding like a board of directors. That's a great analogy. The other thing that you can do, other than, you know, varying your mentors, is varying your own personal experiences. And so try to work in different environments, whether that's different cities, get as much experience as you can in different subspecialties. I know for myself, I trained in Ontario. I then did my fellowship in Quebec in the French system. Now I work in Quebec in the English system, and that has really enriched my practice. And finally, use every opportunity you can to ask questions and to enhance your knowledge so that you can make informed decisions. So in summary, my 5 points are to actively engage with your mentees, for mentors to lead by example, to sponsor opportunities, and then for the trainees to recognize where you can go for help and to familiarize yourself with different perspectives. Thank you so much.
Thank you, Dr. Zainab, for your great talk. Thank you so much. Our second presentation about mentorship in ophthalmology will be with Dr. Ike Ahmed. As I mentioned, we'll take questions and answers at the end of the presentations.
Well, thank you very much. Jazakallah here. Thank you. Assalamu alaikum, everybody. I'm pleased to be here. If my slides are not showing, please let me know. Yeah. I am definitely in over my head hearing everybody speaking here. When Nuran invited me, I probably waited a few days before replying. And I said, well, maybe I should be out of my comfort zone and speak on something I don't normally talk about. Of course, I talk about ophthalmology a lot, but mentorship is something that is near and dear to me, but I don't speak about it as much. So thank you very much for this opportunity. It's been a few years since I've been to KCASH in Riyadh, and I very much enjoyed visiting the facility. I very much enjoy speaking and meeting colleagues, and I particularly enjoyed having a huge buffet dinner at the Ritz-Carlton. Absolutely an incredible place. So what is mentorship? I think we've heard already a lot of great thoughts and principles around what mentorship is. I think to me, most importantly, it's about a relationship. It's about a bond. And as I said before, I'm probably not the best person to speak about it, but just yesterday actually had a very good example of mentorship, which actually is showing my wife teaching my son, Yusuf, how to cook biscotti. This is a great example of mentorship. Having a mentee learning side by side, enjoying, having them, learn their own skills and having it in a nice, friendly environment and really teaching them well. And I want to take this moment to send my regards to Helen Badi, Judith Paranson, and Abbas Gavam Rasul from Ruby, because these are all colleagues of Ruby's. And as you all probably know, she's much more better suited to speak about this topic than I am. But she was very kind to give me some advice about this topic, and she wanted me to send warm regards to the group here. So what can I talk about? Well, I can tell you a bit about myself a little bit, because I am a mentee. I have a mentor. I went to the University of Toronto for medical school and residency, and I had zero mentors, zero. I was a bit lost. I felt very different than my supervisors and my teachers. And it really wasn't only until I went to the University of Utah, where I really enjoyed being able to be myself and spread my wings. And that was because of my mentor, Alan Crandall, who happened to be my supervisor, my preceptor, my coach, my trainer, and really my mentor here, who really allowed me to blossom, allowed me to operate despite breaking my orbital rim and breaking my wrist in my fellowship. And we have developed a lifelong friendship where I probably would even say that I think we've become mentor and mentees to each other in some ways over the years. I also think it's a thrill to be a mentor, and we've already heard about why we become mentors, the ability to understand generational thinking, to learn new perspectives, lifelong relationships. It's absolutely an incredible adventure being in a position and a privilege to be a mentor, because as a mentor, I believe you are chosen to be a mentor by the mentees that are around you. And although those that are perhaps thinking about being mentors aren't sure you can be a mentor, and I certainly am in that camp, I think it's a real privilege to be in that level. So what roles do we play? I mean, our roles intersect in many different ways. We spend often more time with our trainees and with our residents than we do with our families. And we play a wide variety of roles to each other. I think we've already heard about, where we differentiate between teachers and coaches and mentors. I probably don't do a good job differentiating these, but I think there are good ways to kind of think about the different roles we play. I think as a teacher and a coach, I look at myself as instructing or training on specific knowledge and competencies. It's based more on formal instructions and acting as a trainer and based on my expertise. When I wear my mentor hat, I think is providing more counsel and guidance, helping the mentee develop their values, and it's based more on relationships. It's more informal. I feel more as a counselor and advisor, and it's absolutely based on trust. I do think there's a lot of overlap, and I'm not one to divide so much. I often lump things together, but I think it is helpful to know the differences. Certainly in medicine, we talk about learning objectives and goal settings. I think this is also a way to differentiate the formal instruction and teaching versus coaching. There are often specified times that define metrics and skills, identifying basic concepts and points and standardizing things, and we generalize it to the level of training. And we have competence criteria to determine whether we've met those or our trainers have meant that. As opposed to goal setting, which I think is what mentors help to do, is more not defined by time. It's generalized. It's visualizing a future path, and it's individualized to the specific person, based more on personal values and life fulfillment than anything else, I believe. Mentorship to a mentee, again, is of course many different things, expanding knowledge, skills, everything else. But to me, the most important thing I believe that we can give to our mentees is the ability to have them have the superpower of knowing they can do anything. They can do anything. The mindset, the approach, the confidence to do absolutely great things in their career, in their life, with their relationship. This is one of my recent fellows, recent fellowship.
Turn around now.
So that feeling is an incredible feeling to see someone who you've worked with as a mentor or as a teacher fulfilling that type of confidence. I believe we're all in different journeys. We have different ways we're heading in life, and our journeys intersect. And for many of us, our journeys as mentors and mentees intersect at certain time points. As Professor Batty talked about, a conversation that has changed someone's journey and someone's approach. I think this is, again, where we fit in. I think our goal is, again, equipping our folks that we work with the best skills on this journey, making someone the best they can be, opening doors, challenging convention, saving lives and eyes, of course, as ophthalmologists, innovating, helping us grow and making a difference. And I think that personal fulfillment is so much more of what a mentorship can provide to somebody, and making that journey fulfilling as you are part of that individual's journey in life as a mentor, as a teacher, to do that. I think a lot of this starts with values, and we all have our own values. We don't mean to put our values on others, but we need to know our own values as we share our perspectives. And whether it's, for me, it's thinking differently, it's having passion and compassion, each of us will have our own values, and I think it's important to do that. I think as a mentor, I think it's so important to love what we do and have the passion for what we do and the energy to share it with the world. Most of all, leading by an example that we set to those around us, both in and outside work. I think making it enjoyable, sharing the fulfillment that we get from what we do, and setting expectations, developing trust. And I think it's important that we don't have a personal agenda or self-interest. As a teacher, we do. We want to see a student pass and fail, perhaps, or not fail, sorry, to pass. But we have to be sure we don't put a personal agenda into this mentorship process. The relationship is an absolutely incredible bond. It is absolutely the most incredible bond that I've witnessed, a sacred, special, emotional, and enlightening part of life. And it's fulfilling, I hope, on both sides. When we talk about mentorship and surgical specialists, I think things are a little bit different. Of course, we have clinical patient and surgical things, but this technical aspect of knowledge transfer as a mentor as well, I think, is where things are a little different as well as a surgical specialty. It starts by creating the right environment in the place that we learn or the place that we discuss and talk. That sets the tone for the discussion and allows our minds to be open and receptive. And I think one of the things I think that is really great to see is an ability for an individual to spread their wings. Because often folks that are working with us, maybe have less experience, don't realize how far they can spread their wings and how far they can fly. And teachers, again, transfer skill well, but they don't necessarily show an individual how far they can spread their wings and how we can go past the limits where we can perhaps as a mentor see where someone's line is and push them to go a bit beyond. Because often we're not the best persons to do this because we happen to be in our own comfort zone. And pushing people out of the comfort zone, getting more fulfillment, being happier, gaining the confidence, embracing the unknown, the excitement of life is part of, I think, what being a mentor is, to push people gently with the right support and the right safety parameters to do this in the right way. Because it's really beautiful, because things really grow when we go outside our comfort zone. It's always a balance between discomfort and comfort, of course, between the challenge and the support, as we've heard. And I think we do this by putting folks in challenging situations safely and supportive and be there when ready. Failure is okay, and it's an opportunity for constructive learning opportunities. We get people back in action and do it again and repeat until we're competent, and then we gain excellence. Confidence is there. We go further. We push folks into complex situations and we share and teach. Now, that's all great. But in mentorship, I think it's the lessons learned from this that are most important. I always talk to folks that look to me perhaps as a mentor, is building the curiosity and the thirst for knowledge and asking why and making no assumptions is part of that journey that we're in. Thinking about Johari's window in terms of, we typically think of the things that we know and things that we don't know, but pushing folks to actually challenge ourselves into things that we don't know about, that I think, again, give us a bigger perspective on where we want to be in life. And I often tell my folks that work with our students, residents, and fellows, that the most dangerous phrase in our language is the way we've always done this. And I think as mentors, our goal is to take folks away from the typical teaching curriculum and let them explore a different way. And teachers don't do that. Teachers tell folks to do it this way and follow my instructions and do exactly what I say. I think mentors don't do that. Mentors should allow one to spread their own wings. And again, as the Dunning-Kruger effect, has investigated and we've seen great work on this area that I really love reading about, that the skills we need to produce the right answer are exactly the skills you need to recognize what the right answer is. And so we need to question what we know to do that. I think mentors help to do this. We're often going from the spectrum of surgeon. We have a beginner as they take a surgeon from the beginning stages of their career to competency, and then hopefully to excellence. As you can see, I need a haircut and I need to shave. I need COVID to be over very soon, I hope. What does it mean to be good? I think CanMeds and competency-based education are excellent ways to look at competency with these 7 areas of competency, and I won't go into this in detail. But of course, this is the way we're all moving toward education. And I think thinking of Martin Broadwell, the great management trainer, how he's described going from unconscious incompetence to conscious incompetence to conscious competence, and then to unconscious competence is what we're all trying to strive toward those that we work with. This means, again, having the right curious approach, digging deeper, making no assumptions, and understanding and imagining and practicing repeating. To going to a place where we don't know how bad we are, to knowing how bad we are, and then to learning and telling ourselves what to do to make ourselves good, and then really to doing things in a way we don't even tell ourselves how to do things well enough. And this curve will change, of course, throughout our careers. So much of what we do is really about our attitudes as we approach medicine and learning. I think mentorship teaches us about this. And when we think about how do we approach our abilities and our skills, we can think of the will and the skill. And as we've seen, in terms of looking at hiring practices and what makes folks do great work, coachability, emotional intelligence, motivation, temperament are the majority of what makes someone a great or a competent person. And technicalities are perhaps less important than the actual attitude that we bring to what we do. And this may require someone to be trained from a lower skill to a higher skill, or someone to be coached in terms of the thinking and the work ethic and the attitude to get to that place of high skill and high attitude as well. And taking a page out of Jim Collins' book, The Hedgehog Concept, I think it's very important to know what we're good at, what we're passionate about, and what drives us to really hone in on what we can be great at. And I think sometimes as mentees, it's hard to know that, and mentors can help shape that and help identify those areas as well. And of course, as surgeons and as physicians, we want to achieve better outcomes, higher efficiency, improved safety, and greater satisfaction. How do we learn and what do we need to learn? Well, we think about different aspects of learning, the mindset, the cognitive skills, and the motor skills. Too often as surgeons, we only focus on the motor skills, when the mindset and the attitude we bring to the operating room is almost as important as the physical skills of doing them, where the cognitive skills of problem solving and role playing are just as important as actually executing the technique by our hand. Dealing with complicated cases really means we have to rise above the typical competency and basic learning. And this is how we look at things in a more simplistic way. And complexity really can be something we can look at in a variety of different simple aspects. Imagination and visualization is very important in surgery, something that we try to teach and mentor folks to. And really just the act of doing it. I apologize for this slide here. I had to put it up here. But really just the act of doing and seeing trainees do things and do it well and practicing really drives competency and excellence. And hard work, I always say, beats that talent when talent doesn't work hard. I think truly if we can inspire mentees to believe in something, I think truly that we and our mentees can do anything, and anything is possible. And I've seen it so often in my life, both inside and outside of my profession. Because although textbooks and surgical training labs teach surgeons how to do things well, what they don't teach well is the human spirit and the human factor of being great and being a compassionate physician. And I think we try to put this in our curriculum, and that's important, but that's such a valuable thing, I think, that as a mentor, we can transfer to develop that confidence in tapping into one's own human spirit, not mine, but that one's own human spirit to do what they can do. And most of all, as we do this, we must put aside our ego and maintain humility. Ego destroys the learning process and destroys humanity, actually. It's a natural thing. We need to check it out and check it out our ego. Diversity is something that's very important. This is not what I train my mentees to do, not to copy me and follow me like on Halloween here, but really being different is the beauty about, I think, how we learn and seeing the diversity in mentorship. And really, I think this is such a perfect aspect of how do we learn new ways to do things, how do we bring new ideas to the table, and by embracing diversity, this is truly what allows us to bring all these ideas together. Teaching the value of teamwork is important, of course, as we work in an operating room environment. Valuing the aspect of everybody that we work with, and again, bringing everybody to the best of their ability as we work together. And most of all, and finally, I think we cannot ignore the most important part of what we are as physicians, which is empathy, which is at the end of the case, grabbing a patient's hand and having that empathy and connection with that patient. Very important to remember about balance though, right? Life, work, personal, and family, very important as we think about ourselves as clinicians as well. It's about the journey, not the destination. It's about the people, not the outcome. Thank you.
Thank you so much. I think you just gave us a lesson. When a physician is a human being, training is different. And I'm going to take my camera more to OR after your lecture. So thank you, Dr. Ike. Our last presenter is from Saudi Arabia, Dr. Rima Al Affari. She's going to be talking to us about mentorship in Saudi Arabia.
Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, everyone. I'm so happy and thrilled to be part of this amazing group who are experts in medical education and give amazing talks in mentoring. I have to admit that Dr. Ahmed made it very hard for me to speak after him, but I'll do my best to make it interesting. My presentation will be about sharing the experience here in Saudi Arabia. But before that, I want to thank you, Amani, and thank you, Nuran, for giving me this opportunity to participate in this talk. So my presentation will be divided into two parts. The first part will be about our experience in establishing our mentoring program in the Faculty of Medicine for undergrads at King Abdulaziz University. And after that, I'll talk about the main guidelines that were done by the Saudi Commission for Health Specialties for mentoring clinical residents. I'll end my talk by giving some take-home messages. But before going to the formal talk, I want to reflect on my personal experience and thank all the mentors. Yes?
If you could just put it
sorry.
on full screen, I'll just the button. Thank you.
Sorry about that. So I want to thank all the mentors I have in my life, starting with my dad, who was the first mentor who taught me a lot. He was and still a great advisor. I want to thank Prof. Fida. She was my mentor since I was a medical student until now. She showed me, the support and the guidance I needed in my undergraduate studies. When I went to Toronto and I started my academic fellowship, Prof. Batty was there for me, and she had great impact on me professionally and personally. And when I did my academic leadership last year, Prof. Austin also gave me and shared a lot of insights and wisdom with me. So I want to thank them all. I believe that every successful person had a mentor who helped them along their way. And all these experiences that I had gave me the motivation to think how we could help our students to move forward and to do well and to do better. How could we support them? How to raise the awareness among my colleagues about the importance of having a mentoring program in a structured way. Because the clinical teachers, I believe too that if they show interest and give time and dedication, they will be remembered. So at the end, it will pay off. Our duty in the faculty as academic doctor, beside teaching, training, doing research, is to support and encourage medical students and refer them to the right support when they needed it. So the idea of establishing a mentoring program was evolved. And in 2012, I found that already in the faculty, there was a core committee who was responsible for distributing the students among mentors. So we thought as a team to take it a little bit further and to try to do some modification. We adopt the Prime network that involves planning, implementation, recruitment, and monitoring and evaluation. So in 2016, the formal structured unit was formed with an excellent dedicated team. And it was mainly for the students in the basic years, which includes second and third year. Then the higher administration, including the dean, vice deans, the faculty members, thought, why don't we continue the process and involve the students in the clinical years? And we were brave enough to start this process last academic year in 2019. And this was the start, but with COVID-19, things a little bit slowed down. But hopefully in the coming months, we will shift from being like physical meetings and do it to have the online virtual style of doing the meetings. So the main mission of our unit was dividing the students among faculty members who are interested and who are dedicated in teaching those students, and we are responsible to arrange meetings and sending forms to be filled by the mentors while they are meeting their mentees. Again, we show the full description, how they're gonna communicate and what are the roles of the mentors and the responsibilities of mentees. Maybe in the other slide, I'll mention some of them. The process is the mentor will be assigned to see group of mentees. He will meet them for a group meeting for once in the beginning of the year, just to break the ice, just to know them. And after that, it's the duty of the mentor to arrange for one-to-one meeting with those mentees, and they will have a special form. We tried our best to follow the GROW model, which is describing their goals, if they are facing any obstacles, if those goals are realistic for them, and how to carry on and how to move forward. And if the mentor detects any alarming signs or red flags in the mentee, like psychological issues or they are not feeling well, and from the psychiatry perspective, there is like an urgent referral form. They have to fill it as soon as possible, and we will be the link between the mentor and refer the mentee to the well-being clinic and to be seen by a psychiatrist or a psychologist. And those are some of the roles and responsibilities that we share them with the mentors and the mentees. Like what everybody said, that the mentor has to be a role model. They have to share their experience and wisdom with their mentees. They have to act as a guide to achieve educational, personal, and career goals. And again, it's also the autonomy of the mentee to be responsible, to be able to express their concerns, to identify their goals, to be able to discuss the plans. So it's a partnership. It's not, because most of the comments we receive from the mentors that it's getting overwhelming, that we have to take decision on behalf of the mentees. So we have to clarify that it's a contract between the mentor and the mentee, and the decision maker here is the mentee. So we need to shift the mindset that to decide on their behalf. So this is needed a lot of work to encourage students to speak up, to be confident, to feel safe to express whatever concerns they have. So again, to ensure confidentiality and to ensure security, usually those forms will have the academic number of the student. No names are mentioned, and a copy of these forms will be, part of it will be a copy in our unit, and another copy will be shared with the academic affairs office, whether in the basic years or in the clinical years. To ensure that the process is done properly and monitored, before end of the year, we send a feedback form that should be filled by the mentors and mentees, just to discuss how things went and the process, if they faced any challenges, if they have any suggestions to be documented. And those forms will be collected, data analysis will be done, and an annual report will be sent also to the academic affairs, and the vice deans will have a chance to review them, and we can also share them with the faculty and students, like in general. I want to share with you some of the challenges that we faced during these through these years since we started the mentorship program. That it's always an issue between the ratio of students to the mentors, because every year the number of students is increasing. So we're trying our best to involve junior staff, to train them to take the lead and be mentors. Also, we have issues regarding logistics in terms of place and time, but I believe now when everybody is moving now to virtual learning, I believe it will be easier for the mentor to meet his mentees virtually. I believe too that some of the clinicians with the busy schedules and the tight timetables for students, there is like lack of commitments, but relying on students and encouraging the peer mentoring, we were able somehow to overcome this kind of issue. The medical education department at the Faculty of Medicine run 2 training workshops per year, and we have been participated in training other faculties like nursing, dentistry, and pharmacy. And we can see that it's a chance for us to share experience and learn from others. And we came up with some recommendations when we collected all the forms and the suggestions from the teachers and I mean the mentors. We found out that the keys for successful mentorship program is dedication, things to progress. We need time. We need now to respect the identity of our students. And in the past, maybe the students were shy to express their needs. Maybe they like to be, maybe I'll use this terminology, they like to be spoon-fed or to follow their teachers. They didn't have this kind of identity. So maybe nowadays, in this generation, I can see the differences in the mindset and their personality. And anything to be successful need patience, and we need to be flexible as much as we can to accommodate more mentees and to start, if nobody started yet, the mentorship program. Maybe the next part, I'll talk about the postgraduate and what are the things were done by the Saudi Commission for Health Specialties. They did great effort in the previous years to develop guidelines for mentoring those residents, because as everybody knows, residency training is a formal academic program for residents to develop their potential to become a full specialist. And it's different than the undergraduate program, where the residents have to rotate in different and multiple centers. So building a long-term relationship, it's quite challenging for the mentor and the mentees. But as the speaker said, maybe it doesn't need to be a long-term relation. Maybe a short-term relation with specific goals will make the mission completed. So the guideline design and describe the nature of the relationship. It's about having a partnership between the mentor and the mentee. The most important thing about this kind of relationship is to detect the residents who are in difficulty as soon as possible before they finish the year. So if they need any kind of intervention or support, they can intervene. And again, providing career guidance is one of the most requested option for residents from year 1 until year 5. Again, the mentor and mentee, at least they have to complete 6 months to determine whether the relationship is compatible, and if things didn't work very well, there was no click or no chemistry, or for any reason, they can have the chance to be assigned to a different mentor. Because until now, there is no like a full option that the resident could choose his mentor. I know it sounds not logical, but because they want to divide all the mentees among the whole consultants, and everybody can share. We tried it in the undergrad that only the interested mentors can put their names, and they welcome mentees. So we found like only 5 who are like popular, and the rest of the faculty members maybe avoid this kind of relationship. So we thought to share the whole faculty and consultants and divide and assign all mentees among them. Again, the guidelines showing what role the mentor do, because sometimes it's overwhelming. Again, what to do, how can they communicate, what do they have to say to them. So this guidelines will give them the framework, how to share their experience, how to help them to be comfortable, and what is expected from the mentees themselves. And again, any sensitive information will stay confidential between the mentor and the mentees. And unless there is something major, a very sealed report will be sent to the program director or the head of the department if any other action should be done. Maybe here I'll share again the responsibilities of the mentees. We are training them to be responsible. We are training them to be advocates for their needs, and to recognize their needs in learning and in their career, and to be responsible to arrange for these meetings between themselves and their mentors. The advised time is they could meet once every 4 to 6 weeks. This is what's recommended. If they feel they want to meet frequently, it's up to them. But usually the guideline says it's better to take a month or a month and a half, so they can have their logs ready with if they have any issues or something, they can discuss it. And usually it doesn't take more than an hour. Usually the mentor take 2 to 3 residents according to each program, because there is a variety of programs and it depends on the number of mentors. And I was lucky to speak to different program directors about what challenges they see. I know this is something, it was offered by the Saudi Commission. It sounds idealistic, but in the reality, sometimes it's not done the way we expect it to be done. So the time frame is still an issue between the mentors and the mentees. The consultant or the mentors, they want more training. And I believe that the Saudi Commission, they are building new training programs to help consultants and trainers to get the skills how to be an effective and better mentor. The mentees need to show more commitment and expressing their concerns so they can make better options. And from the start, the mentor and the mentee has to have this kind of vision where they want to reach, and how can they move forward in this relationship. As I said, sometimes in some programs, the mentee has no option to choose his mentor. So for that, I believe that training different trainers and a big number of trainers will give a chance to increase number of effective mentors to share in this program. And again, to make it less overwhelming, I do believe that mentors act as a link between whatever resources is there in the institute or in the center. This is the role. We refer the mentees who are in need to get these resources. And I'm so happy that one of the initiatives that are done by the Saudi Commission, it's called Da'im. It's a new initiative that is full with services and help psychologically and through psychiatrists to support the well-being of the residents. And at the end of my talk, I hope that I didn't talk so much. I finished maybe I talked so much. To end it, I just want to summarize the golden tips that I wish anyone who's interested in mentorship or already started his program, that the mentorship partnership requires flexibility and engagement. And I do believe that honest and clear communication can deepen the trust between the mentor and the mentee. Our job as mentors to create opportunities for our mentees to grow. And the good news, there is no ideal way to mentor. Just find your own path and find your own way and start. And I'm so thankful for doing this kind of webinar where many program directors are here. So we can work together, we can share our fears, but at least we have to start. Thank you so much for everyone. I learned a lot from all the speakers, and I wish that everybody will benefit from this experience. I have a lot of references here that everybody can share it. So thank you so much.
Thank you, Dr. Reem. That was a great talk. It shows how much you're passionate for what you do. Congratulations.
Thank you, Amani.
As I mentioned, we'll take the questions and answer at the end. Dr. Nuran will share with us the take-home message. You can go ahead. It's only for a few minutes. And there will be a poll at the end if you can share with us your responses about...
Dr. Reem, if you can stop sharing.
Yes.
Thank you.
Okay, thank you.
Okay. I hate to bring it to the end because this was a really beautiful webinar. But these are some of the take-home messages.
Nuran, do you see? I don't see your slides.
Yes.
No, slides are not showing. I don't know why.
Really? Maybe my connection is not that good.
If you cannot show the slides, you can tell them to us, maybe. Okay. So I think she logged off and she's going to be back, if I'm not mistaken. So
yes.
Are you back now? Yes, can you
I hope it's on. Do you see the slides?
No, no. Try again.
Well, I'm sharing.
Can you sign out?
Maybe I can just say it verbally.
No, you can sign out and come back. I'll take a question meanwhile.
Okay.
Okay. So we'll take the first question till she's back. So the first question is, I would like to know if you have any mentoring software like Mentor Click or Mentority for mentoring relation in ophthalmology. Is anyone aware of any mentoring software? Any of the speakers?
We in our programs in family medicine and in our master's programs and fellowship programs, we don't use any software.
Okay.
It's still done manually by the program director.
Okay. So here's another question. Hi everyone, I'm glad to see you again. What about making the formal mentoring in undergraduate education more effective? Should we keep it to the students to choose their mentors? Anyone would like to answer? Or I'm not, do you see the questions, the panelists?
Yes, we saw them. I can take a little bit of a first stab at that, and maybe other people can come in. I think that there is some value in having a formal program and connecting people who don't know the system, who are maybe new, to a mentor. But as Judith pointed out, you can have a board of directors of mentors. And so that doesn't mean that the student can't have two mentors. The formal one that's established through the program, and somebody else who they connect to personally, who they, interpersonally, there's a stronger connection. And those might be two different types of roles that we as students or our students would benefit from. I'll let other people add in.
Anyone has a comment about our panel?
I was going to say, for undergraduates, sometimes it's very hard to know where to start. And when I was training at the University of Ottawa, we were assigned to mentorship groups where we had a mentor and two students from each year. And the mentor met with that group, a couple of times a year. And so it allowed for both peer mentoring from students a few years ahead of you, and then also an established physician. So that was a really helpful way to gain some perspective, and it was assigned.
Okay. So let me take one of the doctors who raised their hands. I'm going to take Dr. Diego Strainis. He's our medical education head of department. Dr. Diego, do you hear me?
Yes, can you hear me?
Yes, we can hear you.
Yes. Okay. Hello, everybody. So it was amazing. Thank you. It was an amazing webinar. Thank you for all the invited speakers to give this terrific contribution to our program. I have just few comments that I would like to share with you. And first of all, I see some question about how many mentors or do you have you need, or how to choose your best mentor. So one of the things that I noticed in my experience, and I would like also to share my experience with you, that I agree with Ike when Dr. Ike, when he said that you have to give the feeling to the mentor that they can be limitless, they can do everything, because of course you can fix all the problems that they can create, or you have to give them the confidence to find a new frontier. But at the same time, I would point it out, I think probably some of you have already, but I would like, in my experience, to point it out the legacy that a mentor has to give to the fellow residents mentee in general. In my experience, I always remember, especially in the tough time, during surgery or whatever, when you have a challenging case in front of you, what I imagine in my mind, what my mentor, I was blessed. I had two incredible mentors. One is from Canada, Dr. Rutman, and one is from Italy, Dr. Bononta. And I always think in my mind, what would they have said, or what would have suggested for this case, or these moments, in these terrible moments in my surgery. So it's a kind of relation that you have to, that you should have forever. And I always remember the difficult time with them in surgery when they were very strict with me, very tough. But at the same time, I always remember my pleasant conversation about and discussion with Jack Rutman about the origin of the spaghetti, because as Italian, of course, I claim that spaghetti comes from Italy, and he claims that probably spaghetti are noodles first made in China. But this is one of the points that we never agreed. So I would suggest to choose your mentor and have a mutual connection with him that lasts forever. Second point is, I think this crisis, COVID-19, I would say that was a great opportunity. At the beginning, one of you said that, of course, even for us, especially at the early beginning, we didn't have an answer. And of course, I'm pretty sure that most of you felt a little bit even guilty when you cannot deliver any teaching, especially at the beginning when there was the lockdown. But in my experience, of course, I'm not going to promote Kokesh because Kokesh is a big brand. I don't need to promote it. But as a director of continuing education, I was so blessed, so glad to stay in such a great institution, because we switched the day after all the lectures, all the webinars, all the ground rounds online. There was a great support from from the NTV, from the administration, and I think that at least we felt fine with our mentee, because we provide a great opportunity of learning. And you know, also this is something that will be applied for the future. And we develop, I mean, especially with the help also Dr. Vargas, that he had an experience on that on the International Global Forum Education, an international webinars like the one of this tonight. So, and that was a great experience that probably will last forever and will be a great actually for the future. So there is, you know, the bad and the good in any experience. And from my side, I also had the opportunity to come back and give also some lecture for my student in Italy that still from my academic position, I never was giving before, because I'm working here. And so it stay in connection with them. So, you know, that is, I think, the two messages that I would like. First of all, choose your mentor and try to be in connection, emotional, feeling, and intellectual connection, mutual connection forever. And second, I think this crisis taught a lot, all of us, that we have for sure new instruments to teach, and also to make research, because this is another important point. It was so nice in lockdown all the world, when everybody was frightened, it was a little bit in fear. And we have some meetings not discussing about COVID, but discussing about the research program, or in a multicentric study, just meeting on Zoom, that was not before, and discussing step-by-step research, and also the fellows. So it was a great experience also for local fellows to have and to go deep, to dive deep in the research more. So that's only the feelings that I would like to share with all the panelists from our experience, from my personal experience, and from KCASH experience as well. Thank you, and sorry for having taken a little bit long time.
Okay. Thank you so much, Dr. Diego. Thank you. So, Nuran, can you share the take-home message, and then we'll continue? Nuran? Unmute yourself, Nuran. We cannot hear you.
Sorry.
Yes,
yeah. So the take-home message is that the speakers from the first presentation want you to know that mentorship is a special relationship. People can benefit from many different kinds of mentor, the concept of board of directors, and not to forget that mentors themselves can and their organizations derive a lot of benefit from mentorship as well, not just the mentees. Dr. Zainab Khan wanted to know that stronger mentorship is one of the cornerstones of success in ophthalmology. Dr. Aik Ahmed wanted to know that mentorship is about being a good role model. So mentees look and learn from verbal and training guidance, but most of all consciously and subconsciously watch and learn and follow your behavior, action, and nonverbal cues. And he also was saying that mentorship is about helping people becoming their best person. It's not about changing people or making them someone who they aren't. It's about helping them find their best self and giving them the confidence in their abilities and guiding them on the best path to success. Lastly, Dr. Reem wanted to know that a lot of people have gone further than they thought they could because someone else thought and believed they could. And that is the role of a good mentor. We come now to the end of our webinar. Dr. Amani.
Yes, thank you, Dr. Nuran. So if the panelists don't mind, we have a few questions. Is it okay with you? Okay. So Dr. Hind Al-Qattan, she's the program director at King Abdulaziz University Hospital. She's going to comment. Dr. Hind?
Yes, hello.
Yes.
Yeah, thank you very much for this excellent webinar. We have actually started a mentorship in our ophthalmology program at King Saud University, and we have set many excellent examples. I don't want to take so long, but I would like to comment on one of the words that Dr. Aiki Ahmed has mentioned, which is excellence. And I think that we want to go even beyond unconscious competency, as he mentioned, to excellence. And mentorship definitely helps the residents to reach that stage. The other point I would like to mention in relation to mentorship as well is the concept of non-linearity in the teaching. So instead of having a linear educational pathway where you teach the residents the knowledge and the way they should do things, and this is for us is enough. We have to take this beyond to the actual life expectations for the uncertainty that they might face as physicians later on, and all this can be achieved by mentorship. That's all what I have to say. Thank you.
Thank you so much, Dr. Hind. Thank you so much. So also there is the third. So if the attendee can answer the full question, it will be very thankful. The third is Dr. Julian. You can talk, Dr. Julian. Hello.
Hello. How are you?
Fine. Go ahead. We can hear you.
Yes, I have some questions. One was if in any of these programs you use a software for for matching the mentor and the mentee, and for the get in touch within the mentor and the mentee.
Anyone would like to answer? I think we said that there's no soft, if I'm not mistaken.
Dr. Helen is.
Okay.
Dr. Helen?
Yes, I was just going to
Yeah,
say, actually, we have a software program in our Department of Family Medicine, but it's actually for mentoring between faculty members. And you can put in some of your characteristics and your request, and then there's an anonymous matching system with people who have volunteered to be mentors. So we actually have used that because our department has more than 1,000 faculty members spread among 23 hospitals. So it has helped a lot at that level between faculty.
Okay, great. Because I'm working with the International Council of Ophthalmology and the Pan American Association, and we are up to starting a mentorship program, and we are searching for a mentorship software, and there is a lot of mentorship software for corporations, for enterprises, but we didn't find specifically one for medicine or ophthalmology. So we are thinking of develop one of ourselves, or buying some of these that are on the market.
Well, certainly this one, I mean, it's 10 or 12 years ago, I think it started. And it was Dr. Barbara Stubbs working in the faculty development office. I don't know if Abbas knows whether that's still working. I think they developed it themselves. But I honestly don't know, and I'm sure they would be happy to give you further information about how it's being used at the moment. And again,
great.
Abbas is still there. He may know more about what's happening at the moment.
Okay, nice. Thank you.
I'm not sure if they're still using the formal software program, or if it's being done more informally.
Right, but it was for a similar situation, I think.
Yeah, it was definitely about linking faculty who had similar interests.
Yeah.
And in a situation where you have a large number of people, I think a software program makes more sense than trying to do a manual match.
Great, thank you very much.
Thank you so much. So if also the panelists don't mind, we have some questions. So anxiety has increased. Oh, that's an answer to Dr. Abbas. How would you approach your mentor when you reach a level when you feel that they're starting to feel you may become a threat? Is the question clear? Is the question clear? I'll repeat it.
The question is clear. I think we're all not sure how to, who wants to jump in?
Anyone would like to answer, or you want to skip?
No, I think we should answer it.
So who has an experience to answer that?
I think it talks about, there is a lot of article, not so much in the literature, about how do you know when to end a mentorship relationship? Mm-hmm. And I think you do end up having situations where mentees and mentors, especially if they're close in training, may be competing for the same job or opportunity, or that there can be some competition. And I think there isn't an easy answer to that. And I think it's about having, some integrity and some professionalism in saying that this relationship may not be working in the same way it used to. I think it is also okay to say, thank you, I learned a lot from you, and I'm going to look for other opportunities right now. And ending a mentorship relationship is okay. It can be tricky to do, but if it's built on a foundation of respect, then both parties should be able to recognize the value of sort of going different ways, I think.
Okay. So I'm not going to be able to, I think, to put all the questions. There are many. I'm going to look for those who are more useful. How can I find the right mentor?
I can take this
one. Keep talking to a lot of people. Go ahead.
Oh, I was just saying, I think, like Judith was saying, talk to a lot of people. And I mean, if you're really lost, a good place to start could be, your program director, your core faculty that you work with, people that, you see and you see qualities in them that you want to emulate. I think those are really good starting points. I am sure it's very similar at U of T, but I know at McGill, there's really no shortage of really excellent faculty. It's just about really finding the right fit. And so at our program, the mentorship program, the way it's set up is every year you have a different mentor. So over your 5-year residency, you actually can experience different mentorship styles and personalities. But I think your program would be a good place to start.
I can add something regarding undergraduate students. Most of the time they rely to their colleagues or who are older than them. For example, students in the basic year, usually they like to take the advice and the guide from their colleagues in year 4 or 5 in their clinical years, or the interns. And we do in the unit advertise and do orientation sessions for students to know if they have concerns, or they want to, for example, discuss things regarding their options or careers. They can come to us and we will help them to link to the proper mentor.
I would say, if you allow me, suggest somebody that inspire you. That is, I think, one of them. If you don't find anybody around you, try to find somewhere else, but somebody that really inspire you.
And it's okay to have multiple mentors. It's not necessary to be one to answer all questions. This is what I usually tell my students. You can get someone from medical school. You can find someone in business school. You can find someone in the family. So the more you have, it will be easier for you to take different experiences and different scenarios.
I'm a little bit disagree, because I think that finally you have to find one or two that's really you have a mutual, as I said, mutual intellectual connection. But it's not to be confused. But it's just
debatable, Diego.
yeah.
Okay. Thank you so much. I think we're going to take one more question, and we have to conclude. I think time has passed the time we put already. So from Dr. Dana Breaky, she commented, "It's an excellent talk. I'm enjoying this webinar very much. Thanks for arranging and for inviting me to attend. As a mentor, how would you approach the learner when you sense they are going through a problem without making them feel uncomfortable and without seeming like you are intervening in their life? And if you decide to ask, they might deny, although clearly they're going through something. Do we stop right there? And thanks for the tips." Did you get the question? So you want to help someone, but they're not opening fully to you. What do you do?
I think building the trust, Amani, it takes time. Maybe putting ground rules and agenda from the beginning of the meeting, and take it slowly. At the end, it's according to the mentee himself if he's ready to share or not. Sometimes we want to take the role of imposing our opinion and our thoughts into him. He has to feel safe and to feel confident that whatever he's discussing is safe and secure. It takes time. This is from my experience. Some people are open to accept it, and sometimes people want to have their time to have this kind of relationship.
I would also add that the relationship is a mentorship relationship with some boundaries that the mentee has put on it. This is not a therapist relationship. This is not a doctor-patient relationship, and it's not a teacher relationship. And so we as mentors have to be mindful of that and the role that we have. And as Reem said, we make the possibility open. It also might be a place where we say, I notice that there are some things that you're going through. Here are some resources. I am open to talk to you about these things, but there may be some other better people. I've noticed that other people in this situation benefit from speaking to X or Y. I don't need to get into the details, but I can point people in the right direction.
Anyone of the comment? Okay, so by this we have to conclude. It was a great time. Thank you for all the speakers for accepting our invitation. Thank you for the support of our CEO, Dr. Abdulaziz Al-Rajhi. And thank you for the Medical Education Package for making this happen and for their support. And of course, thank you to Dr. Nuran. It was a nice coincidence that we met in one meeting, and from there came the idea of conducting this meeting. And I promise it's not going to be the last. Hopefully we'll do something in future where we can raise the awareness of mentorship and training of our colleagues. Thank you, everyone.
Thank you to all.
Thank you, Nuran. It was great meeting all of you. Hope we meet soon. Take care. Stay safe.
Thank you.
Good to see you.
Thank you. Thank you so much.
Thank you all.
Thank you.
Thank you very much for participating. It means a lot. Thank you very much.
Thank you
to all of you. It was phenomenal.
Yes.
Nice. We can clap.
All inspired, and thank you.
Thank you, everybody.
Thank you.
Thank you.
We'll see you. Bye-bye.
Thank you.
Bye.
Bye-bye.
Bye.